This is a special edition of Late Night Health. I'm Mark Alyn. Our guest is Dr. Ben Stong. He's a plastic surgeon based in the Atlanta, Georgia area. Dr. Stong has recently written a paper about herd immunity and vaccines. We're going to talk about COVID, not only as it affects people who are coming in for surgeries, but in general. Doctor, nice to talk to you again. Welcome back to Late Night Health.
Thanks for having me, Mark.
I'm really interested in a couple of things before we talk about herd immunity. Is the vaccine something that you recommend for your patients, all ages, as long as it's available?
Yeah, absolutely. I mean, even personally myself, I was doing everything I could to get it as quickly as possible. So I don't see any reason not to do it.
And then your staff as well. I mean, you're working with people, right?
Yeah, my staff, and then patients, if they want to come in and they have had a vaccine, we do get their vaccination records for their medical chart as well, just to confirm that they're have the immunity.
Can you, I don't know if this is a medical question or a personal question, but there are a lot of people out there, especially men, who don't want to take the vaccine. Have you heard that?
Yeah, I mean, I have heard of and know people who seem to be very skeptical or reluctant to take the vaccine, and I think there's multiple different groups of people. I don't think it's just one ideology or one group of people that's reluctant, and they're reluctant for different reasons. But I think that to a certain degree, they're not thinking of it in the proper context of what's actually going on in modern America, modern world, modern United States versus what their reasons for skepticism are. And then some of it's just bizarrely conspiracy story stuff that has no relevance to real world applications.
Right. And in addition to being a plastic surgeon, I believe you have another specialty as well.
Yeah, I mean, my residency was in otolaryngology, head and neck surgery. And that's how I ended up going into facial plastics, was through doing ENT, head and neck surgery. I don't do that I don't do that specialty anymore, other than the facial plastics.
Gotcha.
At this point.
But it just shows that you have a broad experience in surgery and in working with patients.
Oh, absolutely. Yeah,
right?
Absolutely.
So let's take a look at what herd immunity is. Let's go back about, I don't know, 1,000 years, and the bubonic plague is raging in Europe, killing, millions of people. Is this something that we can expect, every little bit in our history? Some kind of, pandemic?
Oh yeah, I mean, I think pandemics repeat themselves, every so often. And right now it's coming, it's coming out of animals, and that's where the population that it sort of grows or festers in, and then exposure to humans, creates the pandemic.
And this particular one is so strong, so virile, if you will, that and with all the modifications that it's growing, it's out. It's just amazing that it's happened. I mean, it's really caused a lot of concern, from anxiety to physical ailments. It's real. It's something. I mean, I don't go out of the house without a mask. I go to the market. I go to the gas station. Wherever I'm going, I wear a mask. Sometimes two masks.
Yeah, I mean, it's definitely a real virus, and it's definitely a real issue. I mean, fortunately, our numbers in the United States are going down right now, but places like Europe are experiencing a third wave. I think Europe's having trouble with distribution of vaccines and such compared to the United States right now, it seems like we have a surplus of vaccines. So, for instance, in my home state of Georgia, they are opening today the vaccine to any adult human in the state of
Wow.
Georgia. So as long as you're 16 years of age or older, that you can go get a vaccine. You don't have to be, have a medical condition or anything like that. And I think it's because of the sheer number of vaccines that are available now at this point.
Which is terrific. There are some areas of the country I think they're still behind, but I know that in California, where I'm based, it started slow. Um, you had to be 75 or over. You had to have, even those with pre-existing medical conditions could not get the vaccine. But now they've opened it up to just about everybody, as far as I can tell.
Well, I think initially the rollout was pretty slow, and now it's been ramped up to the point where people are, are able to get the vaccine fairly easily across the United States. Just that now it's really a consequence of whether or not the person or persons trust getting the vaccine or not.
And then the next step, of course, is that here in the U.S., the Johnson and Johnson vaccine has just been approved in the last couple of weeks for emergency use, and another one is just about to be approved. There was some controversy with that, but the fact is that it looks like we have plenty of vaccines. So now we're all vaccinated or not. What is the number that we need to reach so that we can go after that herd immunity?
Yeah, I think we're not anywhere near herd immunity at this point. I think I read the other day that about 1 in 6 or 15 to roughly 15 to 20% of adults in the United States are vaccinated currently. So we have a long way to go. Historically, it certainly depends on the virus causing the pandemics, what number you need to hit to reach herd immunity. But I think, with the estimates being around 70% that I've read for COVID to reach true herd immunity, which basically means enough of your population is immune that the numbers start dwindling of new infections because it doesn't have another host to infect. And I think with COVID, from what I've read, it's about 70% is what they're estimating.
What is the definition of herd immunity?
It's just that enough of your population has become immune that the numbers aren't growing and they're shrinking of new infections, and eventually it extinguishes the pandemic. And then you can have pockets of epidemic virus where there's smaller populations, there's outbreaks, but it's not ubiquitous throughout an entire population.
So we need to get as many people vaccinated so that we can get that herd immunity, so that the numbers won't climb. We won't have huge outbreaks. Would that be the essence of your article?
Yes, absolutely. Numbers are declining right now, but it hasn't, gotten to a point where we are, free and clear from further outbreaks happening. But numbers are trending in the right direction. But absolutely, yes, that's how we're going to get this under control and get back to a more normal circumstance in life.
Well, there's a good question for you. What's normal now? Will our normal, you have kids, they're going to be able to go to school all the time, not wear a mask, play with their kids, go to soccer, basketball, dance, whatever activity they're in that they haven't been able to this last year.
Yeah, I think there'll be phases of getting back to more normal. I think the initial phase will be people who are immune or vaccinated, and you're going to have, I don't know for sure, but a situation where maybe to get into a concert or a sporting event, you show your vaccination record, or you show that you had COVID previously. Some people, even though they are recommending you still get vaccinated despite having COVID, some people are saying that they don't want to get a vaccine because they already had COVID. But your immunity eventually runs out. We don't know exactly how long, and it's probably variable based on the individual's own strength of their own immune system. But I think 6 months is about what they say you should be able to expect of immunity if you've had COVID, and we don't know how long you're going to be immune at this point from vaccination. Theoretically, that's the whole point to doing a vaccine, is it boosts the immune response so that you can maintain longer periods of having immunity as opposed to not. And the goal is for any vaccination is to have at least a year of immunity, and then you have a yearly vaccination that comes out that people have to get.
And that is another area to discuss, in that even if you are vaccinated, you could still get the virus. You can still come down with the symptoms, but theoretically, at least, it would be a reduced outbreak, if you will, rather than dying from COVID-19.
Yeah, I mean, I think the best studies right now are coming out of Israel. As far as the question always was with is there going to be some sort of asymptomatic transmission in people who have been vaccinated? So basically, people who exhibit no symptoms whatsoever, are they infected, and then are they passing it to other people? That wasn't a question that was really solidly answered with the initial studies. Really, the initial studies were looking at severity of symptoms in people who did get it versus people who didn't get vaccinated, and were they fully vaccinated at the time? Those I didn't read those studies that in depth, but 2 weeks post second dose is really what Israel was looking at. And I saw a study come out the other week from there, which basically said, there's a 94% reduction in transmission.
Wow.
So that's a hot, very good statistic as far as, people who have been vaccinated being able to pass the virus along to other people who haven't been vaccinated, or maybe they were vaccinated, and are they going to get asymptomatic transmission? But 94% reduction in infection is an incredible number.
That is, it would stop the pandemic. Some people would still get it, but it wouldn't have the numbers. I mean, as you've noted in your article, over a half a million people, I think, have died here in the United States alone. I mean, it's an incredible number.
Yeah, I mean, it could have been worse theoretically, but I think now we're at least taking it more seriously.
Let's talk about plastic surgery at your surgical center and what you do there as we wrap up. The name of your company is, and it's right there on your chest, and we've had it on screen throughout our talk. I'm going to mispronounce this, I know. Kalos,
yeah.
Kalos. I got it right. Hey, I got it right this time.
There you go.
Yeah, that's good. So let's talk about what Kalos does and how you've reacted to COVID-19 throughout the year.
First of all, we shut down when, for 6 weeks, when the rest of the country shut down. And then when we opened back up, we essentially do no in-office consultations any longer. Everything is virtual. And I get some blowback from people who say, they call the office and they only want an in-person consultation, and we decline. Right now we are doing one or, an occasional, very infrequent one in the office. If they can demonstrate that they've either had COVID, they have to provide us a positive test recently, or they've been vaccinated and we get their vaccine records, but that's still so few and far between. I think we've done one or two in the entire time. But everything's being done virtually to limit the traffic and number of people coming into the office. Staff has been vaccinated at this point. We are COVID testing anybody getting surgery or major procedures in the office. The only real, I think, loophole in our situation are more minor things that people are coming in for, like Botox or filler. We can't reasonably test those people, but everybody's wearing masks. We require people to wear masks. to the office, and now because I'm fully vaccinated for over a month and a half now, I feel a lot better, at least about me not being able to get it, and not bringing it home to my own family.
Yeah, I would think that would be a major, major, major concern. Um, has COVID impacted your business side? In other words, this, if people are sitting around thinking, "Gee, I'm not working, but maybe I need this taken off or this taken out,"
Hmm.
has it impacted your business either plus or minus or about the
Hugely.
same?
I mean, the demand is through the roof right now. In January, February, and even March of this year, we're over 60% growth from
Wow.
last year. The demand is there. People are working from home. They're not. There's not certainly social constraints like having weddings and graduations and such that people used to have more normally. And people are wearing masks. So in facial plastics in particular, you can cover up large chunks of your face while it's healing. So, for somebody who has a lip lift or a facelift, they can cover up their lower 2/3 of their face with just a mask.
Or your neck in my case,
Hmm.
like
Yep.
like that,
Cover up
right?
your whole neck. Yeah.
Yeah, exactly. Listen, doctor, I look forward to talking to you again soon. We have your website up, and if you want to see the paper, we'll have that available too, with a link to that, so that you can read this paper that Dr. Stong has written very intelligently, very easily understood, about herd immunity and how we can get this if you get vaccinated. And I, everybody knows I'm not a big vaccine proponent, but in this case, everybody needs to do two things: get vaccinated and wear a mask, right?
Yeah, absolutely.
Right. I look forward to our next conversation. I'm Mark Alyn. This is Late Night Health.